What if I told you that up to 40% of cancers are completely preventable? Not with expensive supplements or miracle cures, but with simple lifestyle changes backed by rock-solid science. Today, we are diving deep into the latest research on the 7 most common cancers worldwide, affecting over 11 million people annually, and the evidence-based strategies that can slash your risk dramatically. But first, we need to bust some dangerous myths that might be putting you at risk right now. Let's start with some hard truths. Every year, nearly 20 million people are diagnosed with cancer globally. But here's what the statistics don't tell you, and what could change everything. The big 7 cancers we're covering today account for over 11 million new cases annually. Lung cancer, 2.5 million cases. Breast cancer, 2.3 million. Colorectal, 1.9 million. Prostate, 1.5 million. Stomach, 970,000. Liver, 870,000. Cervical, 660,000. Now here's the game changer. Major research institutions like the World Cancer Research Fund have identified that lifestyle factors directly influence your risk for every single one of these cancers. We're not talking about genetic lottery tickets you can't control. We're talking about daily decisions you make about what you eat, how you move, and how you live. Before we dive into the solutions, let's destroy some myths that might be sabotaging your health. Myth #1. Cancer is mostly genetic. There's nothing I can do. Science says only 5 to 10% of cancers are due to inherited genetic mutations. The vast majority are influenced by lifestyle and environmental factors you control. Myth #2. A little alcohol is good for your heart, so it's fine. Science says, here's a shocker, there's no safe level of alcohol when it comes to cancer risk. Even light drinking increases breast and colorectal cancer risk. The data is crystal clear on this. Myth #3. Exercise only helps with fitness, not cancer. Science says, physical activity reduces risk for at least 8 different cancer types. We're talking 20 to 30% risk reduction for some cancers. That's more powerful than many medications. Myth #4. Supplements can replace a healthy diet for cancer prevention. Science says, large-scale studies consistently show that whole foods beat supplements every time. In fact, some supplements in high doses may actually increase cancer risk. Myth #5. If I don't smoke, I don't need to worry about lung cancer. Science says, radon exposure in homes causes 8 to 16% higher lung cancer risk per 100 BQ per cubic meter. Many non-smokers get lung cancer from radon, air pollution, and secondhand smoke. Now that we've cleared the air, let's dive into what actually works. Lung cancer, 2.5 million cases annually. #1 killer. But here's the good news, it's also the most preventable. The science. Smoking increases risk 15-30 times. Quitting reduces risk progressively. It's never too late. Radon testing in homes can prevent 21,000 deaths annually. Air pollution, PM2.5, increases risk 8 to 11% per 10 UGM3. Low-dose CT screening reduces deaths by 20 to 24%. Your action plan. If you smoke, quit now. Use proven methods. Nicotine replacement, medications, counseling. Test your home for radon. It's invisible and odorless. Avoid secondhand smoke completely. If you're high risk, discuss low-dose CT screening with your doctor. Breast cancer, 2.3 million cases. The most diagnosed cancer in women worldwide, but lifestyle changes can cut risk dramatically. The science. Physical activity reduces risk 20 to 25%, especially after menopause. Even small amounts of alcohol increase risk. Maintaining healthy weight after menopause is vital. Breastfeeding is protective. Longer duration, equal sign, greater protection. Your action plan. Get 150 plus minutes of moderate vigorous activity weekly. Limit alcohol to special occasions only. Maintain healthy weight throughout life. If you have children, breastfeed as long as possible. Colorectal cancer, 1.9 million cases. This one responds incredibly well to prevention strategies. The science. Vigorous physical activity cuts risk 20 to 30%. Each 50 g of processed meat daily, equal sign 16% higher risk. High fiber diet, whole grains, legumes, is protective. Screening with colonoscopy dramatically reduces deaths. Your action plan. Replace processed meats with plant proteins. Eat 25 to 35 g fiber daily from whole foods. Get regular vigorous exercise. Follow screening guidelines starting at age 45. Prostate cancer, 1.5 cases. Focus on aggressive forms where prevention matters most. The science, higher body weight linked to advanced disease. Physical activity may reduce aggressive forms. Plant-rich diets show protective effects. Very high dairy intake may increase risk. Your action plan. Maintain healthy weight throughout life. Eat predominantly plant-based diet. Stay physically active. Moderate dairy consumption, stomach cancer, 970 cases. Highly preventable with the right knowledge. The science. H. pylori bacteria causes most cases. High salt diets significantly increase risk. Fresh fruits and vegetables are protective. Test and treat for H. pylori reduces risk dramatically. Your action plan. Get tested for H. pylori if you have symptoms. Reduce salt and salt-preserved foods. Eat fresh fruits and vegetables daily. Avoid smoking liver cancer, 870 cases. Prevention success stories exist. Learn from them. The science. Taiwan cut childhood liver cancer 90% with HPV vaccination curing hepatitis. C prevents most cases. Coffee consumption is actually protective. Obesity and diabetes increase risk. Your action plan. Get vaccinated for hepatitis B. Get tested and treated for hepatitis C. Limit alcohol consumption. Maintain healthy weight. Cervical cancer, 660 cases. Nearly 100% preventable. Here's how. The science. HPV vaccination prevents 90% of cases. HPV screening with treatment prevents most deaths. Smoking doubles risk in HPV-positive women. Real-world data shows dramatic reductions where vaccination programs exist. Your action plan. Get HPV vaccination, effective even in adults. Follow screening guidelines. Don't smoke. Practice safe sex. Here's your evidence-based cancer prevention blueprint. The non-negotiables. Don't smoke. Single biggest impact on your cancer risk. Move your body. 150 plus minutes moderate activity weekly. Maintain healthy weight crucial for multiple cancer types. Limit alcohol. Less is always better for cancer risk. The dietary game changers. Eat the rainbow fruits and vegetables daily. Choose whole grains over refined. Limit processed meat. Replace with plant proteins. Moderate red meat. No more than 3 servings weekly. The medical prevention. Get vaccinated HBV and HPV. Screen appropriately. Colonoscopy, mammograms, cervical screening. Test and treat infections. H. pylori, hepatitis C. Environmental protection, radon testing, air quality. The 80-20th rule. You don't need perfection. Focus on consistency with these major factors, and you'll dramatically reduce your risk across multiple cancer types. Implementing these strategies can reduce your overall cancer risk by 30 to 50%. That's not marketing hype, that's peer-reviewed science. Here's the bottom line. Cancer prevention isn't about luck, genetics, or expensive interventions. It's about consistent, evidence-based lifestyle choices that stack the odds in your favor. The research is clear, the strategies are proven, and the time to start is now. Your homework for this week: pick one strategy from today's video, implement it consistently for 7 days. Comment below which one you chose. Remember, you have more control over your cancer risk than you might think. Use it. If this video opened your eyes to cancer prevention facts you didn't know, share it with someone you care about. Hit that like button if you want more evidence-based health content, and subscribe for weekly videos that could literally save your life.